Everyone, I'm Julia Fulgham, the Director of Advance at UNM. I really appreciate your joining us. We'll probably have another few people joining us, and Sandy will keep an eye on that. I'm really pleased today to have Traye Holland from SHAC with us. Traye's job is to do exactly things like this. That is to help faculty and students know about resources, particularly related to mental health on campus and how to access them. So the plan today is he is going to talk us through mental health resources for students, and we are going to record that part. And then when he hits the end of his formal presentation, we will stop recording and you can ask questions that will not be recorded. So then we'll be posting the recording on our website and promoting it so other people can take advantage of his expertise. So thank you very much for being here, Traye, and I'm going to turn it over to you.
Thank you very much, Julia. Let me go ahead and share my screen here. So before I get into the presentation, can everybody see my slides right now? Okay, great. Well, thank you for having me, Julia, and welcome everybody to this advanced session. I'm very happy to be here speaking to you today. Like Julia had said, my name is Traye Holland. I work at the SHAC building on the main campus in Albuquerque, and I am a part of the health promotion team. My official title is the Mental Health Training and Development Specialist, which is a bit of a mouthful, but the easy way to think of it and the way I like to think of it is that I am mental health's #1 fan on campus. So my job is to go around doing events, outreach, presentations, speaking to staff, students, and faculty to make sure that they are aware of what resources they have and how to connect with those resources. So a little bit about me. I had lived in Oklahoma before I had moved here for this job, and I was working in a rural grant-based organization called the Kickapoo Tribal Health Center. And we actually, it's pretty interesting because whenever I lived there, our biggest concern was the lack of resources available to us. And now that I moved here to this job, the difference is almost the complete opposite. It's that we have so many resources available to the students that it's kind of hard to navigate them if you don't know specifically what you're looking for, if you haven't been here for a long time. So that is going to be the goal of this presentation here, is to let you guys know what resources that we have available and how to connect students with them. Now, I do want to be clear before I go into the presentation material, the limitations of this slideshow. All of the resources I'm going to go through are just specific to mental health. So the ones that address mental health directly. So there are going to be a few resources that you might notice are left out. Say, for example, the food pantry. While it is good for people's mental health food, it's not necessarily specific towards mental health in addressing mental health or talking about mental health topics in and of itself. And if I tried to list all of the resources that we had on campus, we would be here for 3 hours, and I don't think anybody wants to hear me talk that long. So without further ado, let's start going into the resources. So we're going to start with personally my favorite one, and I say personally because they are the ones that pay me. I'm going to talk about SHAC. So SHAC is a comprehensive healthcare service, healthcare facility that is located on the main campus in Albuquerque. And its service is comprehensive in medical care. The idea is to remove as many barriers as possible between a student and a successful college career as possible. So there is a medical field, there is a a medical department, there's a counseling department, and there's a health promotion department. We are going to focus on counseling and health promotion. So SHAC counseling services are available to all enrolled UNM main campus students to help them function successfully in their academic lives. And we know that school is a great thing and college is a great thing, but it is also an incredibly stressful time, right? A lot of these students are out of their homes, out of their parents' homes for the first time, living with roommates that they barely know, dealing with maybe having a job and having an internship or two, or a lot of the interns that we have here actually have 2 or 3 internships on top of ours. So dealing with internships and academics and finances and relationships and all these incredibly stressful things on top of schoolwork that can really make things difficult. And at times you can feel overwhelmed. And so we wanted there to be counseling available on campus for the students. And the services that SHAC provides, we provide psychotherapy, we provide treatment groups, psychological testing if they think that there's some sort of attention deficit disorder or anything like that. We can do testing for those disorders. We have a psychiatrist, so we can actually prescribe medication, and that medication can be provided at, or excuse me, they can come pick up the medication at the pharmacy that is located in the same building. And these counseling services, we also provide mental health workshops. These are monthly workshops that any student can register for and attend, and they can learn about all these different mental health topics that are taught by either me or one of the counseling staff. We have topics as big and broad as, say, grief or anxiety or picking a career, stuff like that. There's a lot of good information through those workshops. But these services are available to UNM main campus students who are taking either 4 credit hours or over, or those who choose to pay the fee. So whenever you have over 4 credit hours, one of the fees that you would pay as a student is the SHAC fee, and this entitles you to a lot of our services. Now, does this resource charge money? Yes, it does. The intake and triage is no cost, but there is a $15 copay for affordable services. We really try to work hard, not only to work with the students' insurance, but to work with their situation to make sure that our services, our counseling is as affordable as could possibly be. It's really more affordable than they will probably get at any time after leaving college. So it's important that if they need counseling, that they can get the counseling they can while they're in school, because it's not going to be affordable later on. Not going to be as affordable. Is there a wait time? Yes, there is a wait time. That wait time varies. Last I heard, it was about 2 to 3 weeks. But I really recommend, especially for new students, if they think they want to get counseling, to be proactive and to schedule themselves up for a triage as soon as possible, as soon as they've registered for classes, to schedule an appointment. Now, how would they contact this resource? Well, if they wanted to schedule an appointment, they would call SHAC's main number, which is 505-277-3136, and that's where they would schedule their appointment. If they have seen a counselor in the past year, they can call SHAC to reschedule, or they can just contact the provider directly through the health portal. And in this slideshow, I've also included the link to the website, the SHAC webpage. If anybody wants to receive the slideshow, it has the link to that webpage right there, so you can check it for more information. So that's our counseling services. And now we're going to talk about health promotion, which is the department that I am actually based in. But we are, health promotion is all about outreach for wellness outreach to the students. And so we provide resources, prevention programs, and services aimed at assisting all Lobos to be the healthiest versions of themselves. And we believe that healthcare is holistic, right? So the brain is a part of the body. The way you treat your body is going to impact your brain. Now, I am the mental health guy, the mental health training and development specialist. So my focus is mental health. But say my coworker, Ben, he also is, he's the physical wellness, the fitness guy, and the sexual health guy. He is just as much a part of mental health as I am, because how you treat your body is going to impact your mental health, right? So here are some of the events or the services that we provide. We provide mental health and wellness workshops, including QPR. And I'll talk a little bit about QPR later, but for example, this event right here is part of those wellness outreach and workshops. You can submit if you are leading a class, or you have a student group, or maybe your group wants to be taught about mental health and wellness. You could submit an outreach request. That outreach request goes to us, and we look at our schedule and we look at the topic to see if that's something we could realistically fulfill. And then we will get back with you and either say, yes, we can do this, or no, we can't, but we'll probably point you to another department that can fulfill that request. So we have outreach and outreach requests. We provide resources. We have activities that we do every semester and sometimes through the summer, and we'll talk about those activities here in a second. We also have a podcast. It's called Honest Tea with Shaq HP, and I've been on it a couple times, but it's hosted by my supervisor, Tiffany, and we have guests come on, health professionals, to talk about mental and physical health topics and ways that students can take care of themselves. This resource does not charge money and there is no wait time. And the best way to contact Health Promotions is to call 505-277-1074, or you can also email me, tholland1@unm.edu. So here is some of the more mental health specific parts of Health Promotions outreach. So I had talked about QPR, and that is a workshop that I actually provide. I am trained as a trainer in QPR, and I've been trained in QPR for about 3 years now. I've been doing it ever since I've been living in Oklahoma. And what QPR is, it is a 3-step suicide prevention training. It's all about recognizing the signs of suicidality in students and how to intervene and connect those students with resources that they need to get the help that they require. It was founded by a suicidologist in Australia, Dr. Paul Quinnett, and it's very, very simple. The emphasis behind it is, what if there was a CPR but for suicide prevention? And it is very good information. It's an hour-long training, and I strongly recommend, if you haven't been trained, to get trained in it. You can either reach out to me or you can reach out to Employee Wellness, but we'll talk about that later. The whole point of this is the more people that are trained in QPR, the better off the students are, because the more people there will be who can recognize those signs of suicidality, and the more people that feel comfortable with intervening. I also oversee one of our outreach initiatives in health promotion called Lobo Balance. And Lobo Balance is all about stress management. Stress management, of course, stress is a huge part of college. And while a certain level of stress is good because that's the brain telling the body to perform, we also want to make sure that we're keeping that stress at a manageable, reasonable level. So we provide outreach, activities, social media posts, information, presentations, all sorts of stuff, all dedicated to stress management, letting students know, first of all, what stress is and what it does to your body, and how to keep it at a reasonable, sustainable level. That way they don't feel impaired in their functioning. They're able to successfully complete assignments and study and live their lives. And their skills really that they can take outside of college once they graduate and move on to their jobs and their careers and their lives. If you have any questions about those things, feel free to email me. My email is right there. And these are the events that we do, or some of the events that are coming up. So Never Ride Alone is an activity that we have coming up April 4th. And I'm going to go through these just to give an example of some of the activities that we typically do throughout the year. Never Ride Alone, we are having Richard Lima. Richard Lima is a guy who bikes all around the country. His brother died by suicide, and so he bikes around the country and speaks at events and universities and public places to talk about his story and talk about suicide prevention. So we partnered with Peak Behavioral Health to bring him here on April 4th to talk about his story. And that's actually going to be a really exciting thing. It's open for students. We've also partnered with the Student Union Building to partner for their art night. And what we're going to be talking about there, students can come by. This is March 31st at 7. And there's going to be food, there's going to be music, we're going to have giveaways, and we're going to provide them art supplies so they can paint and just de-stress, just be in the moment and not worry about assignments or anything coming up. Just be creative, and we will be there to give them mental health information and the relation between art and mental health. And one of the other activities I wanted to highlight is every other Monday, I do what is called Mindful Mondays. And this is a little workshop that we have here in our office where we actually talk about mindfulness, different mindfulness concepts. So we teach them mindfulness in ways that they can practice mindfulness and about the mental health benefits of mindfulness. And you can see there, these are the activities that we've been doing and that we're doing this semester. So last time we did making tea, we actually did what's called a tea meditation. which is all about engaging the senses while you brew a cup of tea and focusing on the tea and not so much focusing on the past or the future. And it's really good for stress and anxiety management. That's something that we do every semester. So that is SHAC's services, and we've really done a great job recently at expanding our services. So one of the big expansions to our services is actually my position. This is a new position. This position didn't start until I was put into the university. Until I started my job here, this job didn't exist. So my outreach and a lot of my presentations are new stuff and new services that UNM is providing to its students. And we've also done a lot of hiring of counselors. We have a new associate director of counseling. We have 2 or 3 new counselors, and we're hiring more actively. So another service that I'm actually, one of my other jobs, I'm the TAO coordinator. And whenever I say TAO, a lot of people think Tao Te Ching. What we really mean is therapy assistance online. And what therapy assistance online is it's a suite of online tools designed to provide you with a toolkit of effective evidence-based mental health resources and interactive modules. So the way I've been describing it whenever I talk to students and to teachers and faculty and employees about it is it's like Netflix, but for mental health. So you would sign on to Netflix and it would be movies and shows separated by genre. So you'd have horror, you would have LGBTQ plus movies and shows, you would have anime. TAO is separated by mental health concepts. So you would go onto it and you would browse content and it would say stress management, it would say anger management, it would say trauma, it would have time management, conflict resolution, all these different mental health topics that you can click on. And there are different modules that you can take that are separated by topic and time. So you can take a course that is as short as 5 minutes. You can take a course that is as long as 2 or 3 hours if you really want to get in depth on the information. And it's all evidence-based, created by mental health professionals. A lot of actual counselors assign TAO modules as a supplement to the stuff that they're talking about with their clients. And it's very, very good information. I've actually utilized it myself to learn about it, and it's very, very good information. Interactive modules, there's videos, there's little quizzes, there's these assessments that you can take to assess your stress level throughout the semester. So students can take a stress assessment at the beginning of the semester and figure out where their stress is at. And then they can take a stress assessment, say closer to midterms or finals, and then see, oh, well, my stress has obviously jumped up now that finals are approaching. Here are some ways that I can kind of manage that stress. And TAO can be used on an individual basis. Students can utilize it, and it's free so long as they register using their unm.edu email. If you try to register using any other email, it will try to charge you. But if you register with your unm.edu email, you can have access to all the content for free because UNM has paid for it. And it can be used on that individual basis by staff, students, and faculty if they would like. But it can also be integrated department-wide. So SHAC utilizes our counselors utilize it. I believe housing actually is set up as a department and they utilize it for any conduct issues. And it's a great way to require students or to have students complete these modules. And you can also upload your own additional content onto it, say like PDFs of writing assignments. If you want them to do a reflection piece after completing a stress module, then you can upload the PDF and then they can complete it, and you can actually keep track of their progress, what they've completed if you're set up as a department. And it's 24/7, 365 access. You can use these modules at any time. If you're doing a module and you have to get up and go to class, they can exit out and then come back and just start up right where they left off. It's a very, very good resource. If you want any, if you have any questions about it or want any more information, feel free to ask me after this presentation or to email me. But that is it for SHAC. So we're going to go into some other resources as well. So the first one I wanted to highlight that's not SHAC is I wanted to highlight the Agora Crisis Center. The Agora Crisis Center, I've actually met with some of the workers at Agora. They are absolute rock stars, very, very passionate about what they do. It is a it's a volunteer-led, accredited 24-hour helpline where trained crisis hotline specialists provide compassionate, non-judgmental help for anyone in need of emotional support. You do not need to be in crisis to call or chat with them. And that's an important thing. You do not need to be in crisis to call or chat with them. They are available to talk with you if you're just having a bad day, or if you're struggling with something and you don't really want to talk with somebody you know, or your parents, you want to be just anonymous and you just want to get something off your chest and have somebody listen. This is a resource that is available to students. So they are a crisis intervention hotline. And whenever I say they are a crisis intervention hotline, I mean they are trained and accredited, like nationally recognized crisis center hotline. They also have an online emotional support. If you would rather chat online through keyboard and typing, you access that through the website. They provide information and they can actually do referrals. If a student wants to get involved, there are plenty of volunteer opportunities. They're always looking for volunteers to answer phones, and they provide plenty of training before you ever accept a call, so you're prepared. And then they also do community outreach through workshops. If you are interested in some workshops, feel free to reach out to them and ask them about it. They're very friendly and are very, very willing to get out there and provide information and resources. So anyone can use this resource. It does not charge money. The wait time, there is no wait time. It does depend on the availability of the volunteers because there are only so many volunteers. If you call and nobody answers, feel free to leave a message. But if you are in crisis, then I would recommend calling. I would recommend calling 988, and I'll get into that a little bit later. But how do I contact this resource? For the helpline, you would call their number 505-277-3013, or you would email for questions or information about the community training workshops, email agora@unm.edu. So the School of Medicine has an Office of Professional Well-Being. This is a resource that is available for medical students, residents, and School of Medicine faculty. They provide curriculum, resources, workshops, and it's all about building these important mental health skills to help you succeed in school and in your professional life. So time management, communication, quality improvement, sleep hygiene, which is a very, very important thing. There are very few things that directly impact your mental health more than sleep. A good night's sleep is very, very important. Financial wellness and personal resilience. So a lot of these very important mental health concepts that are important for not only employees and faculty, but for students. And it's available to students, residents, and School of Medicine faculty. So if you're in the School of Medicine, or if you know somebody who's in the School of Medicine and they'd really like to work on some of these topics, then I would recommend referring them to the School of Medicine Office of Professional Well-Being. The wait time is less than 1 week, often within a day or two. And this is how you contact the resource. You call them 505-272-7979, or you can send them an email. UNM also provides career services, and career services is all about kind of removing that anxiety related to what do I do once I graduate, or what do I do with my life, right? What is my job with a capital J? So career services is designed to assist students, faculty, staff, and alumni in developing, evaluating, and or implementing career education and employment decisions. So they provide career advisement. They are at career fairs and they conduct career fairs. They have a career resource lab. They have job and internship listings. So if you're looking for ways to get involved with an internship, or if you're looking for another job, they provide listings. They do on-campus recruiting, and they provide career workshops. So if you are having any sort of career anxiety, as in, I don't even know what I'm good at, or I don't even know what I like, you can do a career or interest assessment with the UNM Career Services. So does this resource charge money? For students, faculty, and staff and alumni, it's free. There is a small fee if you want to do a career assessment. Community members who are not UNM affiliated can use this resource, but they must have a higher education degree from, it could be any institution, but they have to have a degree. and it would be $20 a session, with the first session free, and they would still also pay a small fee for career assessments. The wait time is within 1 week, and then you would contact them by phone, 505-277-2531, or emailing onlinecareerservices@unm.edu. And like I said, if you have further questions or would like more information, the slideshow does have the links to the website on each slide respectively. COSAP. And whenever I say COSAP, one of the habits of working in public health is you kind of get used to a lot of acronyms. So you'll hear me say things like COSAP or CARS or SHAC, and sometimes I fail to describe them, what it means. So COSAP means the Campus Office of Substance Abuse Prevention, and they are the Substance Abuse Prevention Department on UNM. So they are programs, outreach, and information that is all about informing students, staff, faculty about the effects of alcohol and other drugs, how to promote safe and moderate behaviors, say moderating alcohol intake or safe use of marijuana. And they contest positive perceptions of AOD, which is another acronym for alcohol and other drug abuse. So if you would like information or any sort of research or any sort of knowledge on substance abuse that you can share with students, or referring a student, if a student's curious about this information, refer them to COSAP. The wait time is typically within 24 hours. You can just email them or call them, 505-277-2795. And there's a lot of good and valuable information because as much as we like to pretend they're not, students are drinking on campus, students are using drugs on campus. And one of the biggest, I would say that mental health and substance abuse are shoulder to shoulder. They often go together. So it's important to make sure that students are informed about ways to be safe on campus when it comes to substances. Now, there is also the Collegiate Recovery Center. And I say there is also, I believe they are currently on hold due to staffing. But it was, and it still exists. It's a dedicated resource center that provides programs and services for students in recovery from addictions. And so what that looks like is it provides students with a community. There's a saying that the opposite of addiction is not sobriety, it's connection. So it's all about connecting students who are dealing with similar issues together so that they can provide that peer support and support each other as they go through this journey. And so it's all about making sure that students realize they don't have to sacrifice their sobriety for academics or their academics for their sobriety. So what services does this resource provide? A community of students, recovery supportive programming, a dedicated space. They have a dedicated space where you can meet and provide those peer support groups, and they have a committed staff to them. UNM students have access to this resource. It does not charge money. The wait time, so the CRC is open for drop-in hours and recovery meetings daily. No contact needs to be made with staff prior to attending. You can meet with staff on the day you want to attend or schedule one of those meetings. And you would contact them by emailing recovery@unm.edu or calling 505-277-0560. Or you can attend the drop-in hours meetings at the center. And if you want to know the location, check the Collegiate Recovery Center website. So the Women's Resource Center, and the Women's Resource Center is actually right next to the Shack building. So I've met with them a few times. They're absolute rock stars as well. It's a little building that they're in, or a little couple of rooms that they're in. And I went in there recently to actually talk with them about the services that they provide. And it feels like they have their fingers in everything wellness related. They're absolute rock stars. They do so much for this campus. Very, very, very good resource. And you don't necessarily have to be a woman to access some of these resources. So they do have counseling. They have counseling services, and it's trauma responsive. It's very trauma informed. They also have crisis intervention services with that counseling, and they provide support groups and referrals through this counseling program. UNM faculty, staff, and students can use this resource. It doesn't charge money, but the waiting time does vary. Sometimes they can be at capacity and they just can't accept any more students. But if you were to, it doesn't hurt to check. So contacting this resource, if you were to refer them, you can email the Women's Resource Center's counseling email, wrccounseling@unm.edu, or you can call them at 505-277-3716. And they offer in-person and remote telehealth. Whenever people say telehealth, that's kind of a counseling term. Telehealth just means remote. So meeting with a counselor over the phone through Zoom or through one of their meeting softwares. Manzanita. So Manzanita is another avenue for counseling that is available to students. It's a counselor training facility as part of the counselor education program. So it does not charge money, but there are a couple of caveats with using this resource. So as it's part of training, you are being seen. If I were to use Manzanita, I would be seen by an advanced graduate student. This would be a student at UNM who's in the graduate school for counseling, and they would be the ones who are doing my counseling sessions under the advisement of a professional counselor, a licensed professional counselor. These sessions are 50 minutes, and they are videotaped. That's another thing. Before you set up an appointment, you have to consent to being videotaped. Now, I'm not entirely for sure of the intricacies of who sees these videotapes and who doesn't, but I know that it's for training purposes. It's confidential and only used for training purposes. And then the tapes are destroyed at the end of every semester. But some people just may not like the idea of being counseled, so you might refer them to another resource, but that is an avenue that you can take. It's an avenue that's available to these students. They have specialties, certain specialties. I got this from the brochure. They specialize in life transitions, adjusting to changes, relationship issues, stress management, family conflict, anxiety and depression, dealing with loss and anger management. So really a whole breadth of different mental health topics and important topics whenever we think about students. It doesn't charge money, but like I said, the caveats are being recorded, which could be a turn away for a lot of people, but the waiting time does vary depending on demand and the availability of counselors. But if you want to access this resource, then you should call them at 505-277-7311. And I do want to note that Manzanita is only in operation during the fall and spring semesters. So it's not open during the winter break, and it's not open during the summer. Only whenever that counseling program is active and they're actively training the counseling students will they be able to provide counselors. Another resource is the Department of Psychology Clinic. They have two primary missions, and I got this from their webpage, to provide high-quality mental health care to the community and to provide in-house training for clinical psychology doctoral students. So it's a little bit more research-driven, but they do provide counseling. They provide psychotherapy, psychological assessment, treatment and assessment for alcohol-related problems. They also have culturally sensitive, culturally competent counseling. So if a student is concerned about maybe their culture coming into conflict with their counseling, then you could talk about the Department of Psychology Clinic offering this kind of culturally competent counseling. They have a youth clinic and they do study participation. So this clinic is open to the public. It is open to students, staff, faculty, and members of the community. You don't have to be in UNM to be able to access this resource, but they do charge. It is a very low charge, sliding scale, very low cost, and I'm not entirely for sure about the details of that. So if you have any questions, I would reach out to the Department of Psychology or look on their website. And the wait time, of course, is variable depending on the available therapist. It's just demand. If the counselors are busy and they are seeing a lot of different people, then it's going to be longer before you can go in for your first session. So if you wanted to contact this resource, you would call 505-277-5164 and leave a message. Be sure to speak your name and your preferred contact number, and then your call will be returned within 48 business hours. Now, those are a lot of student specific resources, but I also wanted to take some time to talk about resources that are employee specific, because it is difficult, it is difficult to provide care for students. And I would say actually it's impossible to provide care for students if you're not taking care of yourself. So if you're struggling with something, or if you need somebody to talk to, I wanted to add a couple of employee-specific resources here at the end as well. So the first one I want to highlight is employee wellness. I meet with employee wellness often, especially when it comes to QPR trainings. They're rock stars, very friendly people. They are a part of your employee benefits. So if you are a benefit eligible employee, or if you're a retiree of UNM, you have access to these resources. And what they provide is they have a Working with Positivity 12-week class. That's an online course that you can take to learn about positivity and its role in mental health. It's very intensive, 12 weeks long, but is a really, really, really good source of information on positivity and its impact in mental health. They offer online meditations. It's that mindfulness, and mindfulness is linked to stress management and anxiety reduction. They have these online meditations that you can attend. They also do pet therapy. I love dogs. Dogs are one of my favorite things on the planet. And, you know, pet therapy is a very good thing. It's just that seeing a dog makes me happy, and seeing a dog makes a lot of people feel happy as well. So pet therapy is something that they provide. If you just want to go pet a dog, they can provide pet therapy. They'll have pets in their office. They do individual wellness consultations. I want to be clear that these are wellness consultations, not counseling. They don't provide counseling. They provide wellness consultations. So what that looks like is going to them and talking about ways that you can improve your wellness. They take a holistic approach, so addressing all avenues of your life, and then talk with you about ways you can improve your overall wellness. They do QPR trainings as well. So I do QPR trainings. I'm trained. My area of focus is students for QPR trainings, but I can provide trainings to faculty and staff as well. The reasoning behind that, since Shack services students, but the reasoning behind a lot of the outreach and workshops being available from health promotion to staff and faculty is because if I train, say, a professor in QPR, that is a benefit to the students because they are going to be attending a class where they have somebody who's trained in QPR. So that is a way that I can justify it. But employee wellness is specific to staff and faculty as well, and they provide QPR trainings, and they've been doing them a lot. They've been very busy doing QPR trainings, which is exciting that we're having so many different people, so many different staff and faculty trained in QPR. So if you want your department, or if you want your coworkers or yourself trained in QPR, reach out to them. You can also reach out to me as well, but be sure to reach out to them. And they offer presentations on wellness. Like I said, they take a holistic approach. So they do a whole bunch of presentations with that holistic mindset to wellness. Does it cost money? No cost to benefits eligible employees and retirees. The wait time is typically 1 to 7 days for a QPR training. Might be a little bit longer just because they're so in demand, but go ahead and reach out to them and ask. And you contact this resource by calling them 505-277-4996 or emailing wellness@unm.edu. And there's the website link right there. So CARS, that's another one of those acronyms I was telling you about. CARS is Counseling Assistance and Referral Services. This is counseling for employees. So this is accessible to benefits eligible UNM employees. They promote a healthy work-life balance by providing on-site counseling and services to assist UNM faculty and staff members with professional and personal concerns. So, like I said, UNM wants to take care of their employees, and it's very difficult to take care of your students if you're not also taking care of yourself. So if you are struggling and you want to talk about some of these issues that you're going through, please reach out to CARS. It's part of your benefits. That's what they're there for. And what are their specialties? They cover relationship difficulties, anxiety, stress, and job burnout. Burnout's a huge issue, especially related to stress, depression, elder care, coworker conflicts, alcohol or other drug abuse, managing change, grief and loss issues, and preparing for retirement are just a few of the issues CARS can address. So there are more. If you have any questions, please reach out to them. But they do individual counseling. They also do couples counseling. They do supervisory consultations with organization leadership. They also, during business hours, they can do crisis intervention if you feel like you're in a crisis and you're having a hard time thinking, or you're having thoughts of harm or anything like that. Please call them crisis. They do crisis intervention services. They provide seminars and workshops related to mental health, and they also do trainings. It's free of charge as long as your benefit's eligible, and the wait time is generally within a week. So call the main number 505-272-6868 and leave a message. And it says, make sure, they said on their website to make sure to state your name and preferred contact phone number slowly and clearly, just so that they can know who they're reaching out to. Or if you want other information, email them cars@unm.edu, but don't put any confidential information on that email. So that is really the bulk of the mental health resources that we have on campus. I also wanted to leave you with a couple of important numbers. So here are the Shack After Hours numbers, and I'm going to talk about the specifics of Shack After Hours. So this is if it's after business hours and a student has a medical related question, not an emergency, but a medical related question. They would call the Shack number, which is 505-277-3136, and then press option 2, and they will be connected with a nurse or a nurse practitioner. If they have a question, it's like, why is my eye twitching? Why is my elbow doing this? Any one of those weird questions that, weird things that happen with your body and weird questions that you have to ask. They can talk to a human being and answer those questions. It's not an emergency service, so they're not going to send an ambulance. But if you have a question related to how you're feeling medically, you can call them and they can advise you on tips on what to do, or they can just straight up tell you, hey, you need to go to the doctor. But I want to specify that that is not an emergency number. The emergency number is still 911. They also have an after hours counseling number. So this is for students only, but you call 505-277-3136, which is the Shack's main number. And then you press option 3, and then you are connected with a counselor. And that is if you just want to talk about something or had a question about something. It's not a crisis line. The crisis line would still be Agora, or it would be 988, and I'll go into that later. But it is a way to connect yourself with a counselor. Other important numbers, and I think that these are just important numbers to have. I would honestly recommend having them saved to your 911 is 3 buttons. You don't really need to save that to your notes, but the other 2 I would recommend having saved to your notes or in your contacts list, because the last thing you want to do is have a emergency situation and not be able to remember the number of who you need to contact. So Campus Police 505-277-2241, or Agora Crisis Center 505-277-3013. But in emergencies, the best number is still 911. So if there is an emergency on campus, it's still the best and quickest route to contact 911. So 988 is another great number to just know. It used to be a big, long number, an 888 number. But they actually shortened it down to a 3-digit number. So this is the suicide lifeline. You just dial 988 and you are connected with a counselor or a trained crisis counselor to talk about how you're feeling. And they will talk with you and connect you with resources. That's a great number to just have. But another thing I also wanted to highlight is the crisis text line. So a lot of students nowadays, they don't really like to talk on the phone. They prefer to text. And the crisis text line is a great way to remove that barrier, that nervousness of having to talk on the phone. If they just want to text with somebody about how they're feeling, they can text home to 741-741, and they're connected with a crisis counselor to talk over text. This is 24/7, and it's not specific to suicide. It could be anything that they deem a crisis. It could be stress, it could be bullying, anxiety, whatever they deem a crisis. They can feel free to contact this resource, and it's anonymous as well. But that is it for the information. So I just wanted to say thank you for listening in on this presentation. And I think we're going to stop the recording now to answer any questions that you guys may have. So I'm going to go ahead and stop sharing my screen so I can see your faces. But thank you so much for listening in.